During the pandemic, some of the most essential response has come from more than 60,000 healthcare workers represented by the Service Employees Union, SEIU 1199. On a regular basis, they deal with health hazards in the workplace, but also beyond, whether on public transportation or in communities disproportionately affected by the coronavirus. To
Mhm.
tell us how the union's trying to protect workers and the general public is its communications director, Marlishia Aho. Thank you very much for being with us, Marlishia.
Thank you for having me.
Marlishia, your union represents people who deserve an applause, like just the healthcare workers in New York City. But who are the people that we should be applauding? What are they doing to help?
So 1199 represents healthcare workers in every setting. So that's hospitals, health centers, nursing homes, and private homes, visiting nurses associations. And so they are providing care from the beginning of life until our golden years. And many of them have been, brushing aside fear every day to care for those who have been impacted by COVID. And during this unprecedented time, they have been, being true heroes. And I think we should definitely highlight their commitment, during the last few months, as well as going forward as we, figure out what the new normal looks like.
Well, certainly, I think the scariest places of all for this virus in many states are in these nursing home settings.
Mhm.
And tell me about the union's concerns there, whether it's for the workers or the patients.
When we talk about quality care, that includes the workforce as well as the residents. And so this unfolding tragedy in nursing homes, has been exacerbated by the type of virus that has, preys on seniors and people with disabilities. And, workers have always, risen to talk about how to best provide quality resident care. And that includes having the necessary personal protective equipment, and it should be adequate. It should not be, we should ensure that there's a stable supply chain for PPE. There should not be continued reuse or decontamination. So workers have been really fighting for that in nursing homes, as well as, some of the problems that were evident prior to the pandemic as far as staffing shortages has been exacerbated. And so we are talking about a workforce that has worked in inadequate staffing levels prior and has just been exacerbated during this time. And so this is a workforce that has always also been, undervalued as well as underpaid. And so we need to recognize that going forward, we need to support these workers with enhanced pay to not only recognize those who've been doing this tough work, but also recruit and retain the necessary caregivers to provide care as we move forward. And so I would say definitely, adequate PPE, pay that reflects the commitment of these workers, as well as ensuring that workers have a voice, that have to recognize that the lessons learned should be shaping how do we move forward. And that's including language inclusive training for workers. Again, workers have been on the front lines and their voices matter as we move forward.
Well, there have been some advances in making personal protective equipment reusable, but do you think it's adequate?
No, I think as the state begins to reopen, I think it's really important to look at the supply chain. Everyone is now looking for a PPE, and we don't want that healthcare workers don't have a stable supply chain, especially as every industry is going to be looking for PPE. So we want to ensure that the supply chain is stable and is not over reliant on reuse and decontamination.
What about testing? Tell me about the difference between the testing that's going on currently and what you think should be going on.
We applaud the Baker administration to ensure that testing is available for nursing home workers as well as the residents that they care for. And that should be applied to all caregivers in every setting. There should be priority testing for healthcare workers because they're going to continue to be important as we move forward during this time. And so ensuring that they are tested regularly is important. Obviously, there's conversations about what is regular, what does that mean, but we hope that priority testing is important. That it happens for caregivers.
When you look at policy for the workers, you do have to look beyond the workplace itself. Many of them are people of color. They're from communities disproportionately affected by the virus. So how should policy reflect that?
Yes, communities of color have been hardest hit, and we see that in the workforce that we represent. When we talk about the healthcare workforce, nursing homes and home care, majority women of color, immigrants, and we need to protect them. We need to hear them. We need to ensure that they are protected either with PPE, again, enhanced pay, again, doesn't address the work that they're doing and the fear that they are brushing aside, but we want to ensure that they are valued. We can't just call these people healthcare heroes and not have the policies in place. We need emergency sick time. Again, we cannot, there's various policies across the industries, and we need to have one kind of like an essential workers' bill of rights to really ensure that they have the protections needed. So it's emergency paid sick leave, presumption of exposure to COVID at work. So there's no denial of workers' comp claims if they are exposed to and contract COVID-19. We need to ensure that these workers are protected going forward. And it's important as we think about what our new normal will be.
Well, I think what's also normal is employers blame shifting, saying that when their employees get sick, it must be coming from somewhere else. What's the union's response to that line of thinking?
I think it just reinforces the presumption bill that's currently in the legislature that's being debated, is that we need to ensure that it's the presumption that they've been exposed at work. Obviously, there's community spread, there's risk, but we believe that we should be supporting the presumption bill that is currently in the legislature, state legislature, because that is what our workers are encountering.
Well, one of the things that your union is also aware of are many people around the country and even beyond, is the wave of protest, the Black Lives Matter message. What's the union's part of this?
We care for Massachusetts, and we care for Black lives, and Black lives matter. And as I mentioned, majority of our workers are women of color, immigrants, and these are important issues to them as well. And so we stand with those who are fighting for fighting against racial injustice, and we will continue to do that in our work as being an anti-racist organization, as well as uplifting the voices of those been marginalized. And we hope to do that soon with an healthcare worker action across the state and across our union to really reinforce that we are in this fight together. As a healthcare industry, we're in this fight. This is a public health crisis.
Well, the crisis hasn't stopped with second phase of reopening, and one of the things that you're concerned about are the adaptations that are maybe precautions essentially, but might also compromise care in some ways. In nursing homes, for example, any reduction in care that you're concerned about?
We are, as the state reopens, there is obviously the need to have continued conversation across all stakeholders and ensuring that worker voices are part of this. Is again, lessons learned have to be a part of our decision-making process and how best to move forward. And so, we are concerned that, we may adapt to our new normal too quickly, but again, workers' voices are important during this next big step with phase 2. And, as caregivers, health systems determine the impact of COVID-19 on caregiving, we want to ensure that reduction of care is not the pathway forward. We've seen that there's been conversations about, furloughs and layoffs that have impacted health systems, and we want to ensure that the solution going forward is not reduction of care, that we need to continue to have access to quality care in Massachusetts. That is what families have relied upon, and we need to protect that going forward.
Finally, we should just remind our viewers about the event on Thursday. Anything more you can say about time and place, or just where to look for more details?
You can definitely check our website, 1199seiu.org. We're still we're still finalizing the details, but we anticipate actions across scheduled lunch breaks across the entire healthcare spectrum. So nursing home workers, health centers, hospitals, home care, to really do their part to reinforce that Black Lives Matter.